Mental Health Beyond Facilities project will enable the Ministry of Health come up with evidence-based information to help in designing how to scale up the provision of mental health services nationally. The project will be jointly implemented with 2 other countries, Liberia and Nepal, which have also suffered the effects of long insurgency. It will also develop a simple package for communities to help them identify mental health patients and fight stigma as well.
Our biggest obstacle and barrier in providing primary mental health services was the health managers, actually, the in-charges of the lower level units. So we are looking very much forward to the results of this research we are going to do to help us to design packages which will ensure that services are provided at that level.
Whereas mental health cases are on the rise, not much has been done to arrest the situation. According to the World Health Organization, 70% of African countries spend less than 1% of their health budgets on mental health. The situation is compounded by an acute lack of sufficient trained health workers to manage the illnesses. World Health Organization figures show that 90% of African countries have just 1 psychiatrist handling over 100,000 people.
Mental health has far-reaching impacts on productivity, poverty, and influences many other health outcomes. There is also growing evidence of the cost-effectiveness of mental health services. Yet, mental health remains under-prioritized worldwide, especially in Africa, in terms of resource allocation.
In the project, emphasis will also be put on improving the economic livelihood of people with mental health cases in the focus area of northern Uganda, which bore the brunt of over 2 decades of the Lord's Resistance Army insurgency. Many cases of mental health are being reported here.
We treat people to keep them quiet, away from people, but we need to treat people, they recover and they regain their functionality. They are able to work. If they are school children, they are going to school again.
Whereas Uganda has no official mental health data, the problem is on the increase, mainly due to substance and drug abuse, alcohol consumption, increased financial stress in the population, depression, and the effects of HIV/AIDS. The project will develop smartphone software that will enable health workers communicate effectively, as well as help them in solving mental health problems.
So we are going to develop a software that will be in the smartphone, like your usual, maybe Samsung or Huawei, you know those ones. If the patient comes and maybe they are not sleeping, they are not eating, they are crying, the phone could help them say, could this be depression? If you decide that this could be depression, the phone may help you. If it is an adult woman, this could be the dose.
The Ugandan healthcare system provides mental health facilities from health centers 4 to national referral hospitals, but the same services are largely absent in lower facilities like Health Center 3s. It is hoped this project will be used to bridge this gap. Tiaba Satumba Abubakar, NBS Television.